Hi friends, we have this case here. It's one of the best cases that I encountered. This patient is having a 5-month history of dyspnea on exertion. Along with it, there's a 6 kg weight loss and other constitutional symptoms like malaise also present in this patient. Now, this patient is coming to us. He's a farmer by profession. The word farmer actually gives us a lot of history, which is why I keep emphasizing why occupational history happens to be so important when it comes to medicine. We often ignore this topic as a clinician, but the truth is, most of the times, just the history of an occupational exposure can warrant us the diagnosis in just a few minutes, and it's one of the best examples. This case is actually one of the best examples. So the answer to this case is chronic extrinsic allergic alveolitis. It's a chronic form, definitely. So what happens in the acute form is, because this patient is a farmer, there's most often an exposure of certain extrinsic allergens, like you have moldy hay, which is usually found in the sugarcane fields or in the hay fields, where the microorganism associated is Micropolyspora fini. There can also be an occupation of bird handling, and hence it's also called the avian lung or the bird fancier lung, where you have the allergens being the bird proteins or the bird it's the bird droppings basically that happen to be the extrinsic allergens in this case. Often the dust which is generated when the birds flap their wings, that also can be an extrinsic allergen. So depending on the occupational exposure and the extrinsic source of allergen, which in this case is a farmer's lung, most commonly associated to Micropolyspora fini, we can associate this extrinsic allergen exposure to an acute hypersensitivity reaction which occurs in the lung, thereby affecting the smaller airways and the alveoli. This is what happens in the acute form. And whenever this progresses to the chronic form gradually, we can find evidence of fibrosis and nodules, which resembles very much a restrictive pattern or an ILD type of a pattern that we get. So the diagnosis is usually based on spirometry, which would show you restrictive pattern. Serum precipitants can also be measured. BAL can be taken and be associated to trying to find out the specific source of allergen. But unfortunately, most of these cases do not have a good prognosis. Long-term corticosteroids is the mainstay of treatment, and despite treatment with long-term corticosteroids, most of these patients at some point of time definitely have a higher chance of developing fibrosis and developing respiratory failure and death eventually in the long run. So it's not at all a good diagnosis. I had another case very similar to this, where a woman presented with a history of feeding parakeets, as you commonly call it, and it is the extrinsic allergen from the bird droppings of the parakeet that led her to developing a very similar kind of a pulmonary picture. These patients, she was initiated treatment very early, but unfortunately we lost her due to respiratory failure, and lung transplant often happens to be the only source of treatment. If at all something has to be very curative, it is lung transplant, but how many of us can actually afford a lung transplant in this country? So that is something which I wanted to talk about in this case. So finally, the diagnosis is extrinsic allergic alveolitis, EAA, and that too the chronic form. Thank you so much.